Welcome back to the podcast Heal Without Harm. My name is Dr. Clayton Durr, physical therapist and the one bringing you the truth about the medical system. If you're listening to this right now, it is either because you are supporting me, which thank you. It is because you have neck pain, shoulder pain, or headaches, or you have neck pain and shoulder pain or headaches and someone sent this to you because they care about you and they want to make sure that you get down to the root cause and actually get this thing fixed by seeing someone like myself, a physical therapist, or someone else ultimately that's going to help you with this. So let's get into it. If you're someone that gets neck pain, tight shoulders, or headaches that just come and go, you've probably tried stretching, tried icing, massages, medications of different sorts, and just nothing sticks. See, here's the truth. These aren't three separate problems. They're usually one problem with three different symptoms that can present in many different ways, but most of the time they're coming back to one issue. It is something like weak, deep neck flexors. So think of the abdominal muscles of your neck. They're sitting right behind your voice box. Those little small stabilizers, when they're not very strong, they stop working. Ultimately, that muscle, the upper trap, the one that's housing that knot that you just absolutely can't get rid of, it's like that. We'll say it's like that really good friend that never puts themselves first. It always helps out, but then ultimately it gets overworked. And when it gets overworked, it gets tight. When it gets tight, it gets angry. When it gets angry, you get angry because you have headaches. You have neck and shoulder pain. You sometimes even have that issue of that pain going down your upper back. It leads to tension, headache specifically, pain at the base of the neck where your neck meets your skull, and sometimes even wraps over the top of your head into the back of your eye or into your jaw. This is all stemming from weak, deep neck flexors. Another one that we see usually associated with it is scapular, which is your shoulder blade, and upper back weakness. See, when your shoulder blade muscles go offline, your neck tries to hold everything, going back to that upper trap. You know, the one working overtime and causing all the problems. It's not causing all the problems. It's actually the one trying to hold you all together. The last one is sometimes, this one's not that often, but it is a forward head posture. Now, I'm going to get into the posture thing a little bit more later on, but because ultimately when it comes to posture, I think it's overblamed. I guess we'll get into it now. Ultimately, I do think posture matters, but it matters much less than most people think. I care less about what position you're in. I care more about how long you're in that position. A bad posture or a bad position is only an issue if you're there for a long period of time. If you are moving around often and not stressing any one tissue out for very long, it doesn't really matter. Heck, for right now, I'm honestly sitting on the couch, slouched over to the side, doing just fine. If I were to be here for the next 20 minutes to an hour, I may have some cranky muscles afterwards. If I'm moving and shifting every 5 to 10 minutes, usually no issue. Think about long road trips. You're constantly fidgety, sitting back and forth. Where we get into problems is when we have computer workers, people who work at the computer, that may be you, for 3, 4, 5, 6, 8, 10 hours at a time, sitting in one posture. The thing is you get zoned in to whatever you are doing, so the brain starts to bypass these signals saying, hey, I need you to move, this is not comfortable. Your brain starts to ignore those, and that's when you fall into problems. Plus, we're just not made to sit for that long of time. And so just as a reminder, if we have this forward head posture, a lot of the times if you go driving down the highway and you look over at the person driving next to you, their head is out in front of their chest, their mouth is draped open, their mouth breathing, they are hurting the upper part of their neck, they're hurting the upper part of their back, causing bunches of issues. A lot of issues. Just remember, every inch your head goes forward is 10 more pounds of load on that neck. And it's just honestly a breeding ground for headaches, shoulder knots, neck stiffness, and all that. Here's what I want you to remember. Here's what I want you to really take away from this. Your headaches most likely are stress related. They are not stress related. They're usually muscular and very fixable. A lot of times people will say it's arthritis and there's nothing I can do about it. And I want you to know that arthritis is actually a side effect of weak muscles. If you have strong muscles and you move the body a lot, you actually have less chance of arthritis. Arthritis is a symptom, not a cause. Another one, a lot of times people will just say you need to stretch. But see, stretching a tight muscle without strengthening weak ones equals zero progress. Forcing a muscle to try to get longer when it doesn't want to be or it doesn't feel safe in stretching is not going to solve your problem long term. Here's what I really want to talk about, because I had 3 people within one day come in and with neck and shoulder issues. They were all entrepreneurs. And I jokingly said to one of them, I said, you come in here for physical therapy and pain relief, but what you really need is a life coach. And I thought that was humorous, but then thought to myself, I was like, no, this is actually very true, because the issue of her pain was ultimately stress related, but it was a physiological problem, meaning there was an actual muscle spasm in this area. It was a mix of like tightness and weakness within the muscle. It was a mix of stress and a learned, how do we say this? Like a learned behavior of the muscle. Like, hey, every time we get stressed out, we are going to turn on that rhomboid muscle and just lock it down. Don't let it go. But see, stretching, it's not going to stop anything. Heck, even strengthening is not going to really stop anything. What we need to needle it, scrape it, pop it. We need to do something in that area to mitigate the issue temporarily. We need to go through a strengthening regime or regimen, aka doing some rows or cheerleaders, an exercise that I often use, to pump that muscle and train it how to turn on and off without it going into spasm. But at the end of the day, let's look at your life schedule and see what's going on that's leading you to having these higher bouts of stress, telling that muscle to go into spasm. That's what we need. So that's why oftentimes patients who come in with headaches, we're spending 20, 30 minutes sometimes talking through life. What is going on that's got you so stressed out? What are some of the changeables that we can help you change? What are the unchangeables that I can help you manage? How often should I see you to help you get through this period of life, whether it be days, weeks, or a couple months, to keep symptoms down so that you can survive what you're having to go through? That is what's actually going to fix it. Things I usually give people to help fix this and control the controllables is deep neck flexor training, doing stuff like chin tucks, and then progressing to head lifts. I can put these exercises all in the description below. Another one, shoulder blade strength, the ultimate fix here. Rows, banded pull aparts, Ys on the wall, an exercise called Blackburns. Ultimately, when the shoulder blades work, the neck can relax. You build some strength in the front part of the neck and some strength in the back of the upper back, and you're going to be doing a lot better. The last one that I really want you to focus on, though, is posture resets. For a lot of people, I say you need to get up once an hour and walk at least 100 steps. They did a study that they found that is monumental for people's blood sugar control, their overall movement throughout the day. It is phenomenal. I had initially wrote down, think chest up and kind of shoulder blade squeezed back. I don't need you to like stay in that position though. So I would say like sit up tall, kind of puff the chest, squeeze the shoulder blades, hold it for a couple seconds, and then relax and go back into whatever posture you want. But it's just like a 10-second reset every 30 minutes to an hour, and you're going to have significantly less symptoms in a couple of days. You're ultimately going to notice this problem does not get exacerbated, and this problem does not build day by day. Here's when you should see a physical therapist, though. Here's when you should see someone like myself to help you with this issue. If you are having pain that lasts longer than 2 or 3 weeks, headaches that ultimately feel muscular or start at the base of the skull, maybe it's in the shoulder, the neck, that upper trap, that base of the skull, or you feel it kind of wraps from the back of your head over the top. If you have shoulder pain with any sort of overhead movements, if you have numbness or tingling in the neck, shoulder, or down the arm into the hands, these are all times that you would come see me or a PT like me. If you notice that massage helps, but only for a day or two, if stretching feels good, but it ultimately changes nothing, these are all times that you need someone to step in and help properly evaluate you and ultimately get you to a quicker diagnosis, get you hands-on treatment for symptom reduction, find the root cause and strengthen the issue, strengthen what's causing the issue so that it's no longer an issue, and ultimately no unnecessary medications, no unnecessary imaging, which usually leads to overdiagnosis and further problems, no unnecessary injections. This is the way we do things. We don't give you meds you don't need, we don't get injections you don't need, and we don't overdiagnose. We ultimately help you solve the root cause. To finish out, I want to connect this kind of to some long-term health here, okay? If you have a weak upper back, it's going to be hard to hold good posture. You're also going to find that you're going to have more pain. If you ultimately don't have good posture, you're going to have limited breathing, decreased activity, ultimately more pain and some other issues to come along with it. And fixing this area boosts your daily movement. It helps you sleep better because you're not stressed or in pain. You can sleep however you want. Doesn't matter how you're laying, what pillow you're using. It's going to build your strength, and overall it's going to keep you independent indefinitely. So focus on these things that I've given you earlier in this podcast. Check out the 2 or 3 videos I have down below. And if you need further help, please reach out. I've got all my contact stuff down below. And if you've been listening this whole time, like, gosh dang it, my mom, brother, sister, cousin, friend, coworker, boss, employee, whatever, that person needs to come see you, aka me, then please forward this to them. Because you don't have to live with neck pain, shoulder pain, or tension headaches, whatever it may be. These aren't random. There's a cause, they're fixable, and you just need help finding that cause. Hopefully today, this podcast helped you learn a little bit more how to heal without harm. Thank you.